I'm a dirty pig. I don't care about OSHA or about patients' well-being. Hi guys, and welcome back to my channel. If you are a returning subscriber, again, thank you very much. And if you are new, hi. Oops, that was my mic. Hi, my name is Melanie Luna Diaz, and I am a dental assistant. And for those who come across my other videos, you probably noticed that I made my day in the life of dental assisting. Most of the comments were pretty positive, so I am grateful for that. However, there was quite a few, just a few, that commented a lot about my lack of glove use.
They ask you how you are, you just have to say that you're fine when you're not really fine, but you just can't get.
Yeah, so this is just gonna be a video kind of just reading your comments, answering your concerns, and kind of explaining why I don't wear gloves or why I didn't wear gloves. And yeah, hopefully you guys don't think that I'm a dirty pig or that I don't care about OSHA or about patients' well-being, because I do.
Melvin do?
So yes, I've been getting a lot of comments about not wearing gloves, touching things. Okay. And I had to answer this question many times until finally I got so many comments about it that I kind of just like said, okay, I'm just gonna do a video on it. I am reading these sideways from my computer, so just know that. Okay, so this one says, please do not touch the ultrasonic or the autoclave without gloves. These are the dirtiest machines in your office. Did I touch the ultrasonic with my bare hands? I probably did. The only reason why I didn't wear gloves when touching that was because my coworkers didn't do that either. And of course you guys know that I am fairly new to the game, and that was my first job. So basically I just followed whatever they told me to do and whatever I saw them do. And I saw them, you know, touch the sterilization without gloves. But the thing about that is that we always washed our hands. Every time that we touched something or before we were about to touch something, we always washed our hands. We made sure to sanitize. There was hand sanitizer everywhere, antibacterial soap, not just regular soap. So it's not like our hands were dirty. But I understand your concern. Okay, next one. Hey girl, a reminder to wear gloves when touching things that are supposed to be sterile, like the cotton rolls, gauze, and the handpiece, and especially after you turned all the machines and touched the instruments in the autoclave. So again, in my video, of course I was not gonna show, you know, me washing my hands all the time, but I did wash my hands prior to touching the gauze and the cotton rolls and the everything. And the thing is that I used to do everything with gloves. I used to set up the room with gloves. I used to do everything with gloves because at my dental assisting school, they taught me like to always use gloves. My workplace where I was at just told me not to use gloves whenever I was touching something clean. And what am I supposed to do? Like, I couldn't say, no, I'm not gonna follow your rules. But now I see that we should always wear gloves when doing that. However, I still see some practices not doing that. You need to wear gloves even if the instruments are clean or dirty. It's not sanitary with you touching instruments from the autoclave without gloves on. In school, you were taught to set up room with gloves on as well. You're touching the high speed with no gloves. That high speed is going to the patient's mouth. If I were you, I would revise going over the rules. OSHA again, definitely wouldn't want to walk in as a patient, seeing an assistant touch everything without gloves. Especially during COVID, your office should have had higher protocols, just saying. I agree. And I actually did set up a lot of stuff without my gloves when the patients were watching, and I had no complaints. Not saying that it was right. Yeah, I guess not a lot of people care. At least not where I was. I'm very surprised that they didn't say anything. But to be honest, if I was a patient and I saw that, I don't know if I would say anything either. I probably just wouldn't go back there again. This one is for same video, different topic. It says, girl, why are you spraying perfume? Can't that be bad for the patients? Patience. Everyone at that office sprayed perfume, and so I thought that it was okay. It would be bad for the patient though if they have some sort of allergy or if they are just like intolerant to smells. So I can see your point on that. And actually now at my new job, I'm not spraying as much perfume as I usually do. You bag the dirty instruments without gloves? No, no, no. If they are dirty, like I always use gloves when they are dirty, especially if they have blood or, you know, like even if I just freshly scrub them, I still use gloves with all dirty instruments. This other one said, so the same jacket you used at work and potentially get splashed all kinds of liquids you wear back home, you were wearing it all day? My jacket is antimicrobial, but I also don't wear it anywhere else besides work. I don't like wear it to go out or anything, and I do wash it, so there you go. And this one says, you should not be scrubbing instruments. There is too much risk of getting stuck. Use an ultrasonic for your dirty instruments. Okay, so for that I say, what about the blood instruments? Because sometimes, like, even if we put it in the ultrasonic and we get it out, it still has blood on it. So I have to scrub. I do agree though, like the splash could not be good. All right, this is the last one I'm going to read. It really caught my attention. I'm going to be completely transparent. Delete this video. Any dentist that watches this or sees this video will not hire you. On top of that, your old employer can sue you for defamation. Okay, so for that, I have to say, you know, I was trying my best to be as respectful as possible to my previous employer, and I wasn't trying to bash anyone in any way. As I said before, even if the doctor was not as understanding or if she was kind of causing me to feel a certain way, I said I understood because it was a high pressure place, but that just was not the place for me. And about the suing and the defamation, I didn't state where I previously worked at. I can't defamate someone if no one knows who I'm talking about, right? Okay guys, well that concludes this video. I hope that this answered some of your main concerns. And again, I want to thank everyone who commented, even if they were not as respectful as I would like them to be. Thank you. Don't forget to like and subscribe and leave recommendations down below to what more you would like to see. Okay, bye!